It's wonderful to be here today from the UK and to provide you with a presentation this morning. As many of you probably already know, Paxman are a family-run business, and my name is Claire Paxman. I'm one of the family members. So I shall start with my presentation. And here we go. Okay, so I'm going to talk to you today about the importance of nurses in the success of scalp cooling. Just very quickly before we start, and for everybody's understanding, I'm just going to give you a very quick introduction to Paxman, but to help you to understand why we are dedicated to changing the face of cancer. So it's no coincidence my surname is the same name as the company, because we are family run. That's again myself, you can see on this picture, and Richard Paxman on the right hand side, who is our CEO, and the gentleman in the middle is Glenn Paxman, who is our founder and chairman, and also dad to Richard and I. So why are we dedicated to chasing zero hair loss during chemotherapy? And that's down to one very special person. Ladies and gentlemen, I'd like to introduce you to the original pioneer of Paxman scalp cooling, and this is Sue Paxman, my mum, my beautiful late mum, who was diagnosed with breast cancer in the early 90s. The prospect of losing her hair terrified her. She did use an older primitive type of scalp cooling, but unfortunately it wasn't successful for her. This is what gave my dad the drive to develop something that worked with his knowledge and understanding of refrigeration and cooling liquids. For my mum, it was the worst point of her cancer diagnosis. To lose her hair had a huge impact on her, and this is what we see every day. And again, what gives Paxman the passion and drive to make a difference, along with our wonderful partners such as Access Devices. My mum, when her hair started to fall out, actually asked myself to cut it off. I was only 14 at the time. So we understand the psychological impact that CIA has on people going through cancer treatment. So it's really important that we understand all of these elements when we are looking to treat people with scalp cooling. And this is where we really come into where the nurses really do play that important role in towards the patients having successful outcomes. So if we look at the psychological impact first, and where this plays a part, and why scalp cooling is so important to offer to your patients, and to have a deep understanding of why losing your hair is so devastating. So it's also important to sometimes, it's very easy to have a medical mindset, but when we're thinking about things like this, it's really important for us to have that mindset of putting ourselves into our patient's shoes. So taking that medical mindset away and thinking about them. Because many people do actually consider hair loss as the most feared and common side effect of chemotherapy treatment. It's the fear of the unknown. It's about that outwardly visible sign of the disease and not having privacy and being able to manage their chemotherapy and manage their cancer diagnosis. So if we just look at some other key factors as well, is that it is the most feared side effect of treatment in over 75% of patients. Again, often the most traumatic side effect of treatment, and can lead to social isolation. People need to and should have normality during their treatment. They should still be able to live with their cancer diagnosis and not feel that they can't live the life that they are having and that they deserve. So this is what the areas that we need to think of and consider. It can affect self-image more than breast surgery. Breast surgery is much easier to cover up and to disguise. Yes, we have wigs and headscarves, but again, they're still very much a signpost to that someone is ill and going through treatment. One of the other factors that we need to look at as well and to consider is the driver of wanting to keep their hair may not necessarily be that individual, but actually their outer circle, their family, particularly young children. It's very difficult for young children or any child to see their their loved one with no hair. Again, it's that constant reminder that they're and the other side again is the privacy. People want to be able to still work or still have a social life, or be able to do those day-to-day tasks without having to tell people or have people, as harsh as it sounds, but pointing or knowing that they're going through cancer treatment. The most shocking statistic that we have is that 10% of patients actually refuse chemotherapy or request a less efficacious treatment in order to keep their hair. So that in itself really shows and proves just how important and how devastating hair loss is. We also have to consider as well that it's now been published that patients receiving adjuvant treatment with docetaxel of a cumulative dose of 400 micrograms per metre squared is associated with significant rate of grade 2 persistent alopecia in about 10% of people. But it's actually shown now that the toxicity is completely stopped with scalp cooling. So all of this is important that we understand the drivers, we understand the emotional toll of why people should be having access to this treatment, and why we should be providing the best treatment as possible so that we can manage these traumatic side effects of chemotherapy and cancer treatment. And so that we can give people, and you as the nurses, can give people control, normality, confidence, privacy, and empowerment through their treatment. So now let's have a look at some of the clinical data, which this is actually we can see that the nurse's role has made a positive impact on the success of scalp cooling results. So we'll first look at the Netherlands study. This initially was started in 2012 and was published in 2015. And it's an observational study of scalp cooling in the Netherlands. And it reported at the time of publication a mean success rate of 48% in 1,411 patients treated with chemotherapy for a range of different cancer types. And we can see from the table on the right-hand side the different types of chemotherapy and the percentage of patients that did not need to wear a head covering. So what's important to see is that this has now been republished last year, and the study now has collected data in over 7,000 patients in 68 Dutch hospitals, and now reports a mean success rate of 57%. And the efficacy has increased due to the improved usability. But one thing is really important to look at in this data is the variation in the results per hospital. So if you can see from the table here, just on this section here, you can actually see that there is a huge variation in the results. Now, the main reason for this and the attributes to this is depending on the competency and expertise of the clinical staff. So as I say, the better results are attributed to the hospitals with a higher competency and expertise in scalp cooling. And this actually means that, or you can see that the mean success rate would have been higher if all hospitals had had the same competency and expertise. Sorry, was that a question? I didn't quite get that.
No, there's some disturbance, Claire. Just carry on.
Oh, okay, I'll just carry on. Apologies. Okay. But then if we then move on to the next study, this is looking at a German study which was published in 2018. This showed that scalp cooling successfully prevents alopecia in breast cancer patients undergoing anthracycline and taxane-based chemotherapies. So it was a prospective observational study including 131 women with breast cancer. The success was measured by patients if they retained more than 50% of their hair and didn't require a wig, and failure was patients losing more than 50% of their hair and requiring a wig. But if we just, again, refer to the actual table here. So this was patients treated with an anthracycline and taxane-based therapy, and 74% of patients were treated with that. And then there was 26% of patients receiving a taxane monotherapy. But if I can guide you to the actual success rate for weekly dose of the anthracycline and taxane, we see percentage success rate of 76%, and 3 weekly 59%, and this is much higher than we do normally see with these types of drugs, in particular the anthracycline and taxane therapy. And again, the main attributes to the success of this study in comparison to other studies using the same device and caps is that the clinic and nurses were all experienced and well trained in the use of the systems. All users had a proficient understanding of the cap fitting and the importance, the critical part of the success of scalp cooling. It is the protocols and the actual cap fitting, and also specific recommended scalp cooling hair care measures were adhered to. So all this information in understanding the importance of scalp cooling for patients, the impact of CIA, chemotherapy-induced alopecia, and the improvements in clinical data really highlights and demonstrates how important the role of you, the nurse, plays in ensuring that patients have the best experience and outcome with scalp cooling treatment. Thank you.